Hey guys, hi, welcome to Unacademy. This is Unacademy Future Doctors, and I am your educator for biochemistry, Dr. Shivangi Shukla. Let me just check if I'm visible and audible to all of you. Just give me a minute to see if the live stream has started or not. Do let me know in the chat section if I'm visible and audible. Is my video clear to all of you? My video clear? Is my voice audible to everyone? Okay, so I'm here with the third session of 2QPD. Unfortunately, the stylus for my pen tab has revolted because I have been taking quite a lot of sessions, around 6 sessions per day. So my stylus has given up now. My stylus is very tired, but we shouldn't be tired. Okay, we have to keep at it, and therefore now I have come up with a. I'll be speaking more now, in spite of having a sore throat. I'll be speaking more in this session, and I'll try and make you understand everything. Also, I have included slides so that you don't face any problem to understand. All right, I'll be getting my stylus. I'll placing the pen tab or something. I'll be doing something about the stylus, but for now अभी ये हमारा देसी जुगाड़ है, ठीक है? So अभी का आज के the last two questions left for tonight. We are currently I'm taking the 2 questions per day series. Okay, this is a type of revision for you guys, because every month what I do is the last week of the month I keep for revising whatever we have read throughout the month. Okay, so in the month of December, for the last week I took a rapid revision series. Now I'm taking a very fun series, that is 2 questions per day series, where I'll be taking up 2 questions in each session, and then I'll be giving you 5 minutes for each question, and you will decide. You will then tell me the answer in the chat section, and then we'll discuss the correct answer and the theory behind it. Okay, so this way you're going to revise one important concept in a retrograde manner and through MCQs. So revising through MCQs always is very helpful, isn't it? Because that way you can remember. Just theoretical rote learning sometimes tends to get very boring, isn't it? So that is why I have come up with this interesting session. Every day I'm taking 3 such sessions here, and 3 sessions I'm taking on the Unacademy app. That is why I think my pen tab has become tired. So you guys would be knowing about the types of subscriptions on Unacademy app. That is iconic as well as plus subscriptions. Okay, you can go to the app and check out these 2 subscriptions. They will give you access to video lectures live as well as recorded. The iconic subscription will also give you access to resources from Prep Ladder, and all of these are available at very discounted prices. And on top of that, you can see the code that I have mentioned here on the page, that is DRSHUKLA. This code is going to fetch you an additional 10% discount. Okay, Dr. Shukla, this code DRSHUKLA, this code is going to fetch you an additional 10% discount. Guys, try and go for this subscription, because this will help you in maintaining a regularity. Okay, and it is going to open a vast array of resources for you guys, which is going to bring in a discipline in your study pattern. Okay, it is going to help you form a timetable, and there'll be teachers who will solve your doubts, who will take up regular sessions with you. Even sitting at the comfort of your home, you can complete the entire syllabus. Now if you keep up with me, I have completed more than 95% of the syllabus of biochemistry, that too twice, once in the month of December and next in the month of January. January may we haven't completed the nucleic acid part, but the metabolism part we have completed so many times that those of you who have been together with me must have been masters of metabolism by now. Anything that I ask of you in metabolism, I think you'll be able to answer. So this rapid revision, again and again, the revision that we are doing for you guys, making you do, that is going to be of help, and you will realize later on that how helpful this has been in your life. Okay, anyway, this is the first question for this session. That is, C peptide is a component of which of the following? Look at it carefully. Look at all the options carefully. I'm giving you 5 full minutes to think and answer. I'm giving you more time to think so that you develop your thought process, because then you should keep on thinking. You should keep on looking at each and every option. You should not just jump at one option. Okay, so this is one way of ensuring that you answer MCQs correctly. All right, so your time starts now. Come on, put up the answers in the chat section. All those of you who are attending, do answer in the chat section, all of you. Come on, guys. 5 minutes. Fast. C peptide. What is C peptide? Try and recall. Where is it present? Prerna has come up with the answer. Very good, Prerna. Is it the correct answer, everyone? You also given your opinion. You all are open to a difference in opinion. You can also tell what you think is the correct answer. Everyone is free to give their answer in the chat section. Do not be hesitant in answering. Okay, again and again I tell you, the most important quality in being a good diagnostician or in being a good clinician is to come up with your hypothesis, or to come up with your thoughts, to increase your thought process. Okay, do not curb it. Not curb it thinking you might be wrong. Yes, of course, no one is perfect. No clinician, no diagnostician is perfect. Okay, even the most experienced of physicians tend to be confused. Okay, the most important or the most pertinent case in example in front of you is COVID, right? It is a new disease. It has been boggling even the brightest of minds in the field of medicine and science everywhere throughout the world. Okay, no one has been able to come up with one particular even a particular treatment for this. Okay, so excuse me. So the thing is that you should never shy away from vetting your higher scientific skills, or from vetting your creative skills. Okay, always sharpen them by increasing your thought process and feeding your thought process. Okay, you should always be up and about, and whatever you're thinking you should be able to articulate it. Okay, that is the most important property, that is the most important attribute of a clinician. All right. Now Vanshika also is answering C. Okay, so there is consonants in Prerna's and Vanshika's answers. Okay, does anyone want to contest this? Does anyone want to put up a different answer? Or all of you are agreeing with what Prerna and Vanshika are saying? Come on, someone or the other 10 ought to have a different answer. Do you think it should be insulin? What about prothrombin? Can C peptide be present in prothrombin? Anyone? Last 2 minutes left to think. Please come up with the answer, guys. Do put it up in the chat section. Okay, I feel quite handicapped without my stylus because I'm in the habit of writing while teaching. It's okay. I'll get used to it, and maybe by tomorrow my stylus gets repaired. Alright. Anyway, so yeah, so last 30 seconds left for anyone who wishes to answer. Come on, guys, try and answer. At least tell if you're in agreement with your friends Prerna and Vanshika here. Very important concept behind this. It is extremely important for you guys to know this. What C peptide is, everyone should know. Okay, so now should I tell the answer? Now, very good, Prerna and Vanshika. You've got the correct answer in the first go. The correct answer is C, pro-insulin. Congratulate yourself, pat yourself on the back. Very good. Congratulations. C peptide is connecting peptide. What is C peptide? Connecting peptide. Now, why is it called connecting peptide? Because it connects the B and the A chains together. So insulin is a hormone. It is a peptide. Okay, what kind of a hormone is insulin? It is a peptide. That means it is a kind of a protein. Okay, so insulin is made up of two chains, B chain and A chain. Okay, this is the active insulin hormone. B and A chains are connected together. Now they contain a lot of disulfide linkages. Disulfide linkages means that have sulfur. Okay, disulfide linkages are present between sulfur containing amino acid, that is cysteine. What are sulfur containing amino acids? Name two sulfur containing amino acids. Come on, guys, in the chat section, name two sulfur containing amino acids. Can any of you do it? Prerna, Vanshika, the girls with the right answers, tell me. Sulfur containing amino acids. One of them I've told you, cysteine. The other, which is the one sulfur containing amino acid present in pulses. It is present in pulses. It is involved in one carbon transfer reactions that we studied just in the last session. We have studied that in the last session. We have discussed one carbon transfer reactions involving this amino acid, which is another sulfur containing amino. Very good, Vanshika. Methionine and cysteine are sulfur containing amino acids. Very good. Now, cysteine residues are involved wherever disulfide linkages are there. Be it in collagen, be it in PTH, parathyroid hormone, be it in insulin. Okay. So, B and A chains are linked together in insulin, in active insulin. But insulin is secreted as a pre-pro hormone. Now, what is a pre-pro hormone? See, insulin is secreted as a pre-pro hormone. Now, this hormone is the mature insulin, that is A and B chain. Okay. But the pro-insulin, the pro part in this, pro is the inactive insulin, that is immature insulin. Inactive, immature insulin contains an extra chain, and that is called the C chain or the C peptide. Connecting peptide. It connects B and A chains together. Okay. Now, what is the pre part? Pre is the guide or the signal. Okay. So this pre part will guide in the pre-pro hormone is going to guide it towards the endoplasmic reticulum, where this pro hormone is going to go. Okay, now the pre part will go. It will say, okay, all right, bye. Yeah, Prerna, very good. Methionine. So, excuse me. There, in the endoplasmic reticulum, the pre part will then be removed from the pro hormone. Then the pro hormone is going to be processed. Okay, the endoplasmic reticulum and the Golgi bodies are the processing centers and packaging centers, processing centers. So the pre part is the signal molecule. It is the guide that is going to guide the pro-hormone towards the endoplasmic reticulum. Now inside the endoplasmic reticulum, the C peptide is going to be removed. The C peptide of the pro-insulin is going to be removed, and B and A peptides are going to be linked together. Okay. Now the amount of C peptide that is removed, the amount of C peptide is equal to the amount of B and A, that is, it is equal to the amount of mature insulin. Okay. So if you have to measure the amount of insulin that is produced in the body, you can indirectly do that by measuring the amount of C peptide. Why? Because it is both is the same. Okay. So you can see pre-pro hormone is the form in which insulin is secreted from the beta cells of the islets of Langerhans of the pancreas. Okay, they are the endocrine part of the pancreas. Okay, the islets of Langerhans are the endocrine part of the pancreas. The beta cells secrete the pre-pro hormone insulin. Now this pre-pro insulin, the pre group will guide it towards endoplasmic reticulum, and it will get removed. The pro-insulin will have disulfide linkages in it. I'll show you how they are. These are the disulfide linkages that you can see. Okay, the yellow bonds. These are the disulfide linkages between the A chain and the B chain. Okay. Excuse me. The A chain is present near the carboxy terminal. The B chain is present near the amino terminal. Okay. Can you see there are intra-chain, that is the linkage present within the chain, as well as inter-chain linkages, that is linkages present between the chains. Okay. Now once these linkages have been formed, now the C peptide can be removed. Okay. Alright. So all the processing has been done. Disulfide linkages have been formed. Now the C peptide can be removed. So the amount of C peptide that is formed is equal to the amount of mature insulin that is produced. Therefore, by measuring the C peptide level, you can indirectly measure the amount of insulin that is produced in the body. Understood? So what is the utility of C peptide? It is to differentiate, C peptide is used to measure the amount of insulin indirectly. How? Excuse me. What is type 1 and what is type 2 diabetes? Type 1 diabetes is when insulin is not produced by the beta cells. Okay. Type 1 diabetes is when insulin is not produced by the beta cells. Why? Because of autoimmune destruction of beta cells. The immune system of the body acts on the same cells, on the auto, it works in an auto manner. That means it destroys the self cells of the body. That means the immune system is not able to recognize that the beta cells of the pancreas are its own cells. The immune system thinks that the beta cells are a foreign gang, and it starts directing its antibodies towards the beta cells, against the beta cells. Then the beta cells will be destroyed, and it is very severe. That is, within a few days to months, what happens is most of the beta cell population gets dead. Okay. Now, what happens is insulin secretion has almost reduced to nil because beta cells have been destroyed by the body's own immune system. So, this is how type 1 diabetes occurs. Okay. Now, what is type 2 diabetes? Here, insulin secretion is normal. It is occurring in a normal manner. But insulin is not able to be taken up by the cells. That is, there is resistance to the uptake of insulin. Okay, got it? Now what happens is all the somatic cells, all the cells of our body, they have Glute4 receptors. Using these Glute4, Glute means G-L-U-T, Glute is glucose transporter. This Glute4 receptor is expressed out on the surface of the cell in the presence of insulin. Okay, now whenever insulin will come and bind to its receptors on the cell, then these Glute4 receptors will be activated, and glucose can go inside the cell and it can undergo glycolysis, Krebs cycle, whatever. Okay. If insulin is not getting accepted by the cell, Okay, if it is not getting perceived by the cell, if there is resistance to the acceptance of insulin by the cell, then these GLUT4 receptors are not expressed by the cell. Then what happens? The glucose that is roaming around, glucose cannot go inside because it requires this GLUT4 receptor to go inside. So what happens? The glucose keeps on roaming around in the body. Insulin also cannot be accepted by the cell, so insulin also keeps on roaming around the body. Now there is so much insulin in the bloodstream that the uh, and it cannot be accepted by the cells. Okay, so what the cells are doing, the cells are thinking that I think there is no insulin that is getting secreted by the pancreas, so the cells will give a signal to the brain to increase secretion of insulin from the beta cells. Okay, now beta cells are confused. They are saying I have already secreted insulin, now I'm getting the signal to secrete more. Okay, all right, then I'll secrete it in extra. So insulin secretion can increase also. Insulin secretion can be more than normal also in type 2. Okay. But still there is resistance to insulin. Understood? Still the cells are resistant to insulin. This is called peripheral resistance. Reduced sensitivity, increased resistance to insulin. Now what happens is, now beta cells are so overburdened, they are so overworked that they start aging and then they start dying. Okay, so initially in type 2 diabetes, because of peripheral resistance, there is normal or increased level of insulin in the body. Okay, but with time, after a passage of time, what happens? The beta cells get very tired, very overworked, exhausted, and they start getting destroyed. Therefore, insulin secretion gradually starts reducing, and in the later stages, the person can become insulin dependent here also. Now, you understood when a type 2 person can require insulin shots, and type 1 person will require insulin shots from the beginning because there is no insulin that is getting formed. Understood? So, what is the utility of C peptide here? In type 1, when there is no insulin getting secreted in the body because of beta cells being dead, if insulin is not getting secreted, then C peptide will also not get secreted. So there will be little or no peptide. Whereas in type 2, what did I tell you? In the initial stages, insulin secretion is normal. If insulin secretion is normal, C peptide will also be normal or even high when there is increased stimulation of beta cells to produce more insulin. Understood? So if the C peptide is, if someone is presenting with high blood sugar levels and his C peptide levels are normal, that means it points towards type 2. If someone is presenting with high blood sugar levels and his C peptide levels are low, it is pointing towards type 1 diabetes mellitus. Understood? Now, one more advantage of using C peptide to measure the serum insulin level is that suppose a person is on exogenous insulin, suppose the person is taking insulin injections, insulin shots, then that the insulin that he is taking from outside does not contain C peptide, isn't it? The insulin that he is taking from outside is not containing any C peptide. But if you measure the blood, suppose you have to diabetic person is on exogenous insulin, and routine monitoring you have to see whether what is his serum insulin level. Okay, so you order the serum insulin level, but the serum insulin test will also detect the exogenous insulin that he is taking from outside. Okay, so it will be confused. It cannot differentiate between the insulin produced inside the body by the beta cells or the insulin that he is taking from outside. Okay, this I am talking about a type 2 person, type 2 diabetic person. Now, another scenario is when you estimate the C peptide. The C peptide will only measure the insulin that is being produced by the beta cells because C peptide is not present in the exogenous insulin. Understood? So, to measure the endogenous insulin, you have to see the C peptide levels. Okay. Also, insulin is subject to interaction with different hormones, also the different states of the body, like maybe starvation and acidosis. The level of insulin changes under stress also. But the level of why? Because insulin will then be excreted maybe slowly or very fast. But C peptide is excreted at a fixed rate, okay, at a stable rate. Therefore, to measure C peptide is better. Measurement of C peptide is a better measure of production of endogenous insulin. Got it? Now we'll move on to the next question. Which of the following is suggestive of diabetic ketoacidosis? High serum insulin, increased serum fatty acids, and high blood sugar. High blood sugar, increased insulin to glucagon ratio, increased CAMP. High blood sugar, increased glucagon to insulin ratio, and increased blood pH. High blood sugar, increased glucagon to insulin ratio, and decreased blood pH. Okay, these are the options. Look at these carefully. I'll give you 5 minutes and then answer. Okay, it is very important, guys, to develop your concept. I'll give you total 5 minutes. Try and answer. Okay. Come on, guys, try and answer. Come on, 2 minutes left. All of you do attempt this. It is a very good analytical question. This is going to test your knowledge, your understanding of diabetes, of acidosis, what diabetic ketoacidosis is. This is a part of homeostasis that we read in biochemistry, physiology, all of these. It is very, very important to develop concept for this. Okay. Come on, last 30 seconds left. Come on, guys. Okay. Hi, Uttam. Hi, Prerna. Both of them have given the answer D. Okay, very good. Uttam has come after a long time. Good to see you, Uttam. So, shall we start discussing? The time is up now. Yeah. So let's start discussing. What are the options? First of all, you should see diabetic ketoacidosis. Now we have discussed in diabetes, what is the main pathology? What is the main finding? It is raised blood sugar level. Okay, raised blood sugar is present in all the four options, so that you cannot choose to eliminate any. Okay, next, look at the first option. It is showing high serum insulin, increased fatty acids. Okay, now is will the serum insulin level be increased in ketoacidosis? Serum insulin level, you give insulin to uh, increase the absorption of glucose into the cells. Okay, for the treatment of ketoacidosis, you give insulin infusion to increase the absorption of glucose by the cells. So serum insulin cannot be high here. Okay, it is wrong. So first option is eliminated. Second one, increased insulin to glucagon ratio. Guys, again, diabetes may there is decreased insulin. Okay, that is why, because of less insulin, what is happening is the blood sugar is rising, because sugar cannot be taken up through the GLUT4 transporters. Okay, so again B is eliminated. C may there is increased glucagon to insulin ratio. That means glucagon is higher compared to insulin. Okay, high blood sugar, very good. But look at the third part. It is saying increased blood pH. What is high pH? High pH is alkalosis. Low pH is acidosis. What is the normal blood pH range? What is the range of normal blood pH? Can you tell me? All those who have given the correct answer, Prerna, Uttam, congratulations guys. Pat yourself on the back. Very good. Congratulations, Uttam and Prerna. Now you tell me, what is the normal range of blood pH? The correct answer is D. High blood sugar, increased glucagon to insulin ratio and decreased blood pH. Why? Because it is acidosis. Acidosis means blood pH is reduced. So even if you don't know anything about ketoacidosis, diabetes should prompt you towards high blood sugar and reduced insulin, and acidosis should point towards low pH. So you can very easily eliminate the options. Uttam and Prerna are saying 7.4. Uttam and Prerna, very good. 7.4 is used for calculations, but whenever anyone asks you for normal range, always for the normal value, always give the range. Okay, make sure as a clinician you give a range. Nothing in the body is pinpoint. Nothing in the body is one exact value. No, because our body is not like a robot. Okay, our body is a is something that can function at a normal range. Okay, like your temperature, we are in the habit of saying that the normal human temperature is 98.6. No, it is also a range. Okay, everything in our body which has a normal value is within a range. So 7.4 is the mean that is taken for calculations, but 7.35 to 7.45 is the range of normal blood pH. Okay, understood? So reduced pH means that is, we consider if it is less than 7.4, then we will consider it as reduced pH. Okay, for calculation purposes. Alright. Now, I think all of you would be knowing about the 4 criteria for diagnosis of diabetes. That is given, these criteria are given by the American Diabetes Association. Okay, that the Hba1c should be more than equal to 6.5%. The fasting blood sugar should be more than equal to 126. The postprandial, that means after 2 hours of 75 grams of glucose, the blood sugar should be 200 milligrams per deciliter or more, and random blood sugar should be 200 milligrams per deciliter or more in a patient who has classical symptoms of polyphagia, polydipsia, and still weight loss is occurring. Even in spite of eating a lot, in spite of having a good appetite, his weight loss is occurring. He has polyphagia, he has polydipsia, a lot of thirst, right, and frequent urination. These are the classical symptoms of diabetes. Okay, so these are the 4 points in diagnosis. Now I want you to know what is Hba1c. Please tell me what Hba1c is. Jatin, I told you in the last session the stylus wasn't working, so I I had to take the liver function test here, but I could not do without writing. So I took up something in which I don't have to write. My stylus has revolted because I have been taking 6 classes per day. My stylus has been exhausted now. I cannot, it is not working properly, so I'll try and get it fixed by tomorrow I'll be taking. I had prepared 2 questions for liver function test in this session, but because the stylus revolted in the last session, so I had to take up something in where I don't have to write much. Okay, got it? Now Uttam is asking, ma'am, can you tell something about abnormal GTT? Uttam, GTT is what? Glucose tolerance test. Okay. Now, when is glucose tolerance test conducted? Okay. Now, in some person where you are thinking that this person is going to have, this person is suspicious of insulin resistance. What is insulin resistance? That normal insulin secretion is happening in the body, but insulin is not getting taken up by the cells. Okay. So what will happen? Right now he is not showing any symptoms of diabetes. Right now his blood sugars are also normal, but his blood sugars are in the pre-diabetes levels a lot of times. A lot of times you can see that he is showing pre-diabetes levels of blood sugar. That is fasting within 101 to 125, postprandial 140 to 200, Hba1c from 5.7 to 6.4. Okay, so there is some suspicion of diabetic tendency in that person. There is a strong family history. There can be classical symptoms, but whenever you conduct the blood sugar test comes out to be normal or towards the higher side of normal, that is still the pre-diabetic level. He cannot match the criteria for diabetes. Then what do? You suspect that there is insulin resistance in that person. Okay, insulin resistance is happening. That is why most of the insulin is not getting utilized by the cells. Okay, so after a point of time, what will happen when maximum insulin resistance will set in, then full-fledged florid diabetes will occur. So to diagnose that before diabetes can set in, you will subject that person to a glucose tolerance test. That is, how good can he tolerate a glucose meal. Okay, you give him 75 grams of glucose to take. Okay, and you make him sit for 2 hours. After 2 hours, you measure his blood sugar level. If the blood sugar level is more than 200, that means that his oral glucose tolerance test is defective and he has resistance to insulin. Okay, this glucose tolerance test is conducted to measure resistance to insulin. Okay, insulin resistance can also be measured by other improved tests like HOMA. HOMA is a marker for insulin resistance. It is conducted through a simple blood test. Okay, normal blood test. Blood is taken and then it is subjected to a lot of analytical analysis, a lot of algorithms, and the HOMA measure is taken out. This HOMA for insulin resistance is going to tell whether the person can develop diabetes later on or not. So this glucose tolerance test is conducted in, most commonly it is conducted in diabetic mother, in mothers, pregnant mothers, okay, pregnant females who are prone to develop diabetes or who are showing that their blood sugar levels are shooting up. Also to screen for development of diabetes in pregnant females, also you conduct. You also conduct them in those who are having metabolic syndromes, okay, that they show obesity, hypertension, hypertriglyceridemia, to check, to screen for development of diabetic tendency. Okay, so glucose tolerance test is to check for tendency of developing diabetes. Okay, how efficiently they are able to metabolize glucose. Okay, understood. Yeah, Uttam is okay. Understood, Uttam. Now Uttam is answering about Hba1c. Hba1c is glycated hemoglobin. That means the hemoglobin gets glycosylated by the blood sugar. Now, when sugar will add on to hemoglobin, it will be attached to it till that RBC is destroyed in the spleen. Okay, and the normal lifespan of RBC is around 90 to 120 days. So this Hba1c on an average gives you the blood sugar control over the past 3 months. Okay, understood. So I think this is it for tonight. I think now we can stop this session. Okay. All right, guys. Then, if you haven't subscribed to this channel, then do subscribe to it. I'm going to conduct similar to 3 sessions tomorrow as well. So 6 questions we'll be discussing tomorrow. Stay tuned to that, and also share it amongst your friends so that we get a lot more interactive sessions, a lot more interactive students here. Okay. Bye bye, guys. Thank you.